So the main points that we want to talk about today, the ARPA funding, I know that that's not going to be discussed until later in September, but we still wanted to at least get ahead of that. Also talk about participatory budgeting and then the actual county budget. And on your right, you'll see some of the logos from some of the organizations that are comprised of the People's Budget, Sacramento. Thank you. The People's Budget survey results versus the county budget. So we've had about 5,000 people take the People's Budget, and what they're looking for are investment in human needs and a reimagined community safety, and not as much in law enforcement and the carceral system. And as we can see, the way that the county budget is really reflected now is that we do see a huge investment in law enforcement and the carceral system, and not as much in human needs. And to really get at some of the core things that you all have talked about today, including those who are unhoused and those who are experiencing a mental health crisis, it's really important that we invest in these human needs, because when we do so, then we can start to really get at the root causes of some of the things that you all were talking about today. Next slide. And so regarding ARPA funding, and Magali, jump in when you're ready. Regarding ARPA funding, we know that the county is set to receive up to $301 million in 2 payments. And so we want to make sure that, again, the community, the residents are being engaged in how this funding is spent. We know that last year it wasn't a pretty sight. And so we definitely want to make sure that transparency and that the communication with the larger community is also there. And I know that there's going to be certain categories that are eligible. And so we want to make sure that those, in those eligible categories, that we're focusing on the needs of those who are low income, Black, Indigenous, people of color, the working poor, and really trying to look at an equitable distribution of these relief funds from the federal government. Next slide. So, for ARPA funding, again, really need to invest in health infrastructures, not law enforcement. We want help for low-income renters facing eviction, right? The rent is very high here. I actually learned the other day that someone moved to San Francisco because their rent there was cheaper than in Sacramento, and that blew my mind, right? So people in this crisis really need some relief. Hotel rooms for those who need them, really facilitating the access to resources that are needed, decentralizing mental health, right? So that people have access in various ways that works for them, and alternatives to 911, which you've already started to talk about and invested $12 million in, which I do. And an equitable relief to locally owned business. Again, when we say equity, we mean those communities who have been historically underinvested in, and who could use this additional support to bring about a more equitable outcome.
Here to talk about participatory budgeting, and we really think that this falls in line with what the supervisors have been talking about, to try and get more engagement, to try and get more community to participate in deciding what the priorities are. And we have one more slide after the business slide. Thank you. So these recommendations that we're making around participatory budgeting, thank you, really prioritize access, education, and open communication, which I think the supervisors would all agree with, and the recommendations that we're making are great first steps in opening the dialogue and creating transparency with your constituents and with the community, and really trying to get that engagement.
We oppose defunding human assistance aid programs, emergency services, economic development. We oppose defunding those. And we vehemently oppose a $16.2 million increase to the sheriff budget. And we oppose a $5 million for the pretrial release program. The public defender's office has, we believe, a better pretrial release, and that's the one that should be funded.